beginning this weekend, there will be no more stage 5. The Back on Track plan with stages was for sure helpful for us to help regain our footing and our economy. But now we must focus on how we'll get to the light at the end of this tunnel. And there is light at the end of this tunnel. We've seen widespread therapeutics like the one Lilly received emergency approval for earlier this week, made right here in Indiana. So proud. And we've seen reports of effective vaccines that will help protect us for the longer term. So we know what game changers they will be when they are widely available. But we got to get there. And our 4 color-coded maps will help us do just that. In September, we introduced the metrics maps that show the prevalence of the virus by county and provides guidance designed to help communities, local communities, make decisions about actions they could take to slow the spread of this virus. Some communities have done just that. They've taken various actions. And you've guessed it, others have not. Blue on the map means there is community spread in a county. The colors progress or worsen to yellow, orange, and then finally red when there is very high positivity and community spread. You can see that in September, a large majority of counties were blue in the state of Indiana, with low case counts and spread of the virus. This week, no county is blue. In fact, only 5 counties are yellow. Most are orange and 9 are now red. You remember last week I was talking about 3. Like many states across the country, we are in the midst of a second surge. So beginning November 15th, and for the next month, I'll sign an executive order that will implement pandemic requirements for all Hoosiers and targeted restrictions for counties that are in the orange and red status. We're taking these steps again to try to reach people who contract the virus, to quarantine those who are close contacts and isolate those who test positive, to protect our hospital capacity, and to give some measure of relief to our stressed and strained healthcare workforce and system. I know, I mentioned this before, I sound like a skipping record. But the best way we can help, it may be inconvenient, but it's also, turns out, happens to be the most inexpensive way to help as well. That means face coverings are still required to be worn by all Hoosiers. And do the right thing by not going to work or other locations when you're sick or symptomatic. All Hoosiers are required to maintain social distancing of at least 6 feet in public spaces, whether inside or outside, and especially when you are with others who are not members of your immediate household. All general requirements are according to the conditions we've already outlined in previous executive orders. Also, the Indiana Department of Homeland Security and the Alcohol and Tobacco Commission, together with local partners and citizen input, will continue to check businesses for occupancy, social distancing, face covering use, and other executive order components to assure compliance. We will now make $20 million available to local governments to support these type COVID efforts. Local governments, including cities and towns and counties, may request funds for such items as local event plan review and public awareness and education and compliance. We'll finalize this program and all the details in the next couple days. Businesses are required to place signage at their public and employee entrances notifying all that face coverings are required. Businesses should admit only those who wear face coverings, practice social distancing, and follow requirements when counties are orange and red. And remember, all customers in restaurants and bars and nightclubs are required to be seated when receiving service. 6 feet of distancing between non-household parties is required, including tables and bar seating. We have to do these things that work, that are proven to work, so our schools can remain open when safe to do so by following the recommendations of our State Department of Health. And on the other end of the age spectrum, Hoosiers 65 and older and those with other known high-risk medical conditions should remain vigilant about protecting their exposure to COVID. That means Hoosiers in contact with individuals 65 and older and those with known high-risk medical conditions should consider suspending in-person visits. As hard as that is, as this surge continues to crest. And obviously, it should go without being said, but please do not visit in person if you are symptomatic or have received a positive COVID test. And wear a face covering at all times around seniors and the more vulnerable.